Hi everyone and welcome to Asami Rat Care. So today's video is going to be on the topic of does, so continuing my does series, and we're going to talk a little bit about health today. So the girls are out and about, so you should be able to kind of feature them somewhat in this video. Right, so the first thing to mention about doe health is that basically what we're going to see in terms of kind of more common issues within the does is it's going to be very much to do with reproduction system. Should introduce one of my new little girls. This is Faye. If you see her looking as though she's got a very freakish eye, she does. She has a glaucoma. Maybe I'll do a video about that at some point. Go on, off you go. I'll introduce the other two to you at some point if they come and visit. In fact, here's one. Here's Hope. Sweetheart. Her grandma is Mog. You may recognise Mog in her face. Right, distraction aside. So, reproductive system. That basically means that most of the issues that are doe specific or common in does that we're going to see are going to be associated with either hormones that females typically produce or around the kind of womb, uterus, that kind of side of things. So first thing, oh, come here Twiz, we need you. First thing I'm going to mention is about probably the most common issue that you're going to have in does. If you own does, you will inevitably see some of these at some point, and that is mammary tumours. So mammary tumours in does that, like on average, and this is based off lab lines, you see around about 60% mammary tumour rate in those rats. Now, in terms of pet rats, it does vary a lot depending on the breeding, so it can drop quite low in lines that are bred for kind of reduction in mammary tumours. What I will say, and it's quite substantial, is mammary tumours are massively linked to weight. So if you get a rat that's a bit chubby, which is why part of the reason why Twizzle is a bit chubby, then that will increase the amount of mammary tumours that potentially suffer from. However, also in balance to that, and the other reason why Twizzle is here, for those of you that saw the preeclampsia video, you can see she is like fully healed up and everything, but Twizzle has been spayed as a result of that. Technically an emergency cesarean where they then took the rest of the bits out afterwards, but she is spayed. And spaying basically reduces the amount of hormones that will help encourage the growth of mammary tumours. So why Twizzle's fat is because she's spayed, and spaying does tend to make them put on weight more easily. Yes, you are fat. Yes, you eat too much food. Yes, we know this. But spaying also reduces the hormones that are around there, and that is probably partly tied with why they get put on weight so easily when they're spayed. She's on a diet. I doubt it'll make a massive amount of difference because I have to balance it with skinnier rats like Snufkin, who's just scooted off there because she thought I was going to make her do something like appear in the video. But yes, I have to balance kind of quite a lot of different rats' weights in there. So for Twizzle to be a nice, slightly skinny weight, Twizzle has to be a nice, slightly fat weight. So we'll get that. But anyway, so mammary tumours, and I do have a whole video on these, so I don't want to go into too much detail. But as a bit of a rule of thumb, mammary tumours are very common in rats. They're partly hormonal driven, which spaying reduces. And I should say, spaying earlier on in life actually has a bigger impact than spaying later on in life. And that is because of the kind of amount of time that the hormones have been around as such. And I am oversimplifying out this one, but that's how to think of it. However, spaying is a big operation, and I'll mention a little bit about spaying because I haven't yet got around to do a video on spaying, which I really should because it's quite a good topic. So spaying, last little baby, this is Juby, Jubilation. She's also a Mog granddaughter, but she clearly looks quite a lot different than her grandma, but she's an absolute sweetheart, aren't you, Juby? Off you go. Yes, so spaying when they're young will maximise the reduction in tumours, the chance of tumours, and I say reduction, it doesn't eliminate them, it just makes them less likely to occur. It kind of like affect that the better the earlier on in life you do, but it's a big up, so you have to balance off their age. So if you wanted to spay protectively, then you would want to spay probably around about the 6 months mark. By that point they're a reasonable age, a reasonable size. In fact, yeah, can I borrow you a sec? Worm here is 6 months as a bit of an example. I have no plans to spay her, even though I'll probably not breed from you, miss, because you're a sweetheart, but she barbers herself. For those interested in what barbering is, if you see she's got a bald patch on her wrist there, that just means she's just ever so slightly nervous. She's actually an absolute sweetheart with me, but she doesn't like me not being here, and she started barbering when she had to stay away for a week. Bless you, you silly little fussball. Yes, so spaying around the 6 months mark is probably about the right age if you're going to do it preventatively. Some prefer doing a little bit earlier. It really depends on how fast your rats grow. I mean, I still think Bug and Worm, that are both these 6 months old, they have a bit of growing left to do. I wouldn't breed from them right now because they're a bit small, so I also wouldn't really want to kind of spay them or put them through a big operation at that age. But it's kind of one of those to discuss with your vets if you're tempted with it. But yeah, so spaying will reduce the chances. However, that doesn't mean if they get a lump later in life you shouldn't spay, because if you're having the lump removed and the rat's doing very well under anaesthetic, then you might want to consider getting them spayed at the same time. Whilst it won't massively affect the amount of the chances of the lumps coming back or them getting more, it will slow the growth rate of any that do come back. So while they're under, it's not necessarily a bad thing to try that. It can't hurt, if that makes sense. However, if they're not doing amazingly under the anaesthetic, the priority is get the lump off and see what happens. And of course, if you remember back to Chocobo, who was my example in the mammary tumour video, she did get some mammary lumps later in life, and I did spay her during, well, she also decided to get uterine bleeding because she was an asshole and didn't like breathing under the anaesthetic, so got spayed at that point, and she still did get tumours. They did, however, grow a lot slower than her earlier tumours, and we're talking about where a mammary tumour took like 4 weeks to get from mine just about detectable, and I'm quite good at picking them up early, to this is so big that I have to chance an operation, or the rat kind of needs to be put to sleep stage in just 4 weeks, whereas I think it was probably about 2.5 months and counting, and her lump still hadn't got to that stage before she had another problem, which meant I had to let her go. So that's kind of puts into kind of context like how much spaying will help slow down lump growth. And it doesn't always have that big an effect, but it's quite a good one. The other thing to think around about the spaying question is the Suprilorin implant, which is a brand name, or I think it's a I can't even pronounce it. I'm not very good with long scientific words, but effectively it's an implant that is for dogs. They also have a ferret sized one, which is a bit small, which kind of acts as a chemical spay or neuter to a point. It's not as effective, but it does reduce the kind of hormones floating around that will encourage this growth, so it's something that some people consider as well. But I will touch on that more when I do eventually do a video on actual spaying. So that's your mammary lumps. Next one to consider that's quite common in does is pyometra, which I probably also pronounced wrong, which is basically a womb infection. So how you find that is, ooh, Crizzle's back. You will find blood around the vagina. Now, for those of you that need a quick reminder, the vagina is not this nub here, it's a small hole underneath it, not to be confused by the anus, which is down here. So it's kind of literally just underneath that nub. If you see blood coming from that hole, and it's usually kind of pure blood, so if you see kind of like a dilute drip, that's normally on the little nub, which is the urethra. That is normally bloody urine, which indicates a urine infection usually, or something along those lines. If you see kind of actual proper blood, it's normally coming from the hole below it. You also sometimes see a classic way to find it is you'll notice a bit of blood on another rat's tail, and that's just where they crawled over it and left a little bit of blood. It usually means somebody in your cage has something uterine going on, and I say something uterine. Some people will say every bit of blood that comes out of the vagina means pyo. That's not the case. There's actually quite a lot of different things that can be bleeding from, like show us bleeding from the vagina. Pyo tends to be quite dark, kind of sludgy looking blood. It's quite bad that I've studied this. When I say studied it, I've seen a few over the years. Whereas things that are not pyo tend to be much fresher, kind of red, like bright red blood. And pyo can also be pus, so it can literally become like pus coming out of the vagina, and that will stink, and you can literally just get a whiff. Once you smell a rat abscess, a rat kind of infection of some sort, like pyo, you will never forget the smell, and it's why I think I might have mentioned it on my health checking video. one of the kind of important things that you can learn to cultivate is a good sense of smell when you've got rats. It seems a bit gross and sniffing your rat's bits, but it can tell you quite a lot of information. So yes, PIO or some sort of womb issue. The other womb issues are typically things like, so they can get uterine polyps, which are like little blobbly things inside, this is such a technical description, inside the kind of uterus. These can get knocked and kind of effectively bleed. You can also get kind of cysts. Polycystic ovaries is one of those names, and you might actually also find that the rat with a little bit of kind of uterine bleeding turned into a bit of an arsehole with other rats or herself. In fact, it's quite a common cause of kind of temperament changes in rats. You can also just get things where there's kind of like a lot of vascular stuff around the uterus, enlarged uterus, just basically weird stuff going on. And more rarely, and I will say that in my 30 odd years of rats and having several rats spayed for vaginal bleeding, I've never seen it, but it can happen, which is a womb tumour or kind of cancer of the womb. It does seem to be fairly uncommon in rats, thankfully. They get a lot of other kind of abdominal kind of tumours, but they don't seem to get loads of womb ones. However, they do quite often get some sort of uterine bleeding. So the treatment for that is typically spay. Spay is probably the best thing to do if spay is an option. If the rat's good, fit health, get them spayed as soon as possible, because if it is PIO, and I will say the colour of blood is not a hard and fast rule, it's just a kind of good indication for you to get a feel for it. But if it is PIO, then a rat can go downhill very, very quickly. And I'm talking about in a few days, they can be so sick they're not going to survive an operation. So you kind of get them in as quickly as possible. If for some reason you can't, you want them on a high dose of antibiotics until you can, and you're normally kind of talking about a few days. And when I say antibiotics, I would prefer them to be on a good combination like Bactrim and Clavamox or Sinulux, that kind of stuff. That combo covers quite a wide range and deals with pus relatively well. The other thing to watch out for is if your rat that is very much not pregnant decides to suddenly look pregnant, and by that we're talking about kind of ballooning. We're not talking about a rat that's a bit chubby and has always been a bit chubby and gets a little bit more chubby. We're talking about a rat having a really rounded, firm belly. That can be what we call closed PIO, which is bad in that effectively that means the infection is sealed within the womb and it's just waiting for a point to kind of break free, and for some reason it's not coming out of the vagina. If it's coming out of the vagina, you have a little bit more time because it's not going to cause an infection inwards as fast. With closed PIO, the only warning you get is your rat looking quite large and kind of pregnant looking. Not like I've swallowed an orange pregnant, but well, not usually anyway. But they kind of suddenly put on apparently some weight, but it feels quite different and it's not kind of like stomach fat. And then they suddenly go downhill very rapidly, and then usually it's too late because it's turned into sepsis or blood poisoning effectively. That is also the risk if you leave PIO too long too. Basically any form of PIO, be it closed or open PIO, you take seriously. So look out for that, and look out for that bleeding around the bits. Any suspect blood in a cage, particularly, well, mainly doe cage, obviously you're not going to have PIO in a buck cage, but any suspicious blood like that, always investigate it. Always try and kind of work out who it's coming from and why. Quite often it's just a torn nail or something like that, you know, these things happen and they're not big deals. But if you are dealing with something like PIO, then it's something you definitely want to kind of check out and make sure that they're kind of okay. It is difficult with closed PIO knowing it's definitely closed PIO until it's too late. The vets in theory could do a UT scan or that kind of thing, check there's nothing else abdominal going on. But yeah, it's not the easiest thing to judge. Sometimes you just have to take that chance, but it is a big operation, so it is one to be sure. And you also need to be very sure they're not actually pregnant when this happens. But yeah, basically get them to the vet if you suspect PIO of any sort as quickly as possible. If you can't operate for some reason, let's say the rat's really too sick for it, then what can be worth doing is putting them on antibiotics for 2 or 3 weeks, and I'm talking like the combination we were talking about before, Bactrim and Clavamox, something quite powerful. Try them on for 2 or 3 weeks and see how they go. Particularly if it's fresh blood, then you may be fortunate, it may just be them passing a little bit of having a very minor polyp or something in that uterus that's not going to hopefully cause them too much issue, but you really need to keep an eye on kind of quality of life at that stage, because you can't have surgery on them, but if it's causing them any discomfort or pain, then they need to be euthanized, because it's not going to get any better. And if you can't remove the problem, then it's kind of like something that you've got to deal with as best as possible for the rat involved. So that's one to bear in mind. So that is a very common one. The other key, like most common issue that you have in females is pituitary tumour. Now, I would definitely, if you haven't already watched it, it's one of my very early videos. I have done a video on pituitary tumours. The reason I say watch it is because it's a lot easier to see the symptoms, and I had a rat involved at the time, Diddy, who had a pituitary tumour. So trying to demonstrate those symptoms is much easier on the video. But in a real quick short overlook, the things you're looking for pituitary tumour is, firstly, the rat not being themselves. So they just seem a little bit like off. You normally get that for a little feeling for a little while. They might seem a bit confused, disorientated. Babies are throwing things on the floor. Then you look for a lack of coordination in the paws, and that's normally, they do things like when they're washing, they would normally kind of go like this. Please don't eat my microphone. Chocobo did that and I had to get a new one. But when they've got a pituitary tumour, then their washing might be kind of like this, and they're kind of missing their noses. And when they're eating, they kind of like struggle to kind of get grip on it, and they end up kind of holding it in kind of two paws. And this shouldn't be confused with an old rat when they put one paw on the ground and hold the food in a single paw. We're talking about really struggling to kind of get grip with the paws, hold them up against bars, and they'll struggle to get the paws around like that. They'll just kind of like be almost flat handing it. The paw thing is one of the #1 ways of recognising pituitary tumours. And then you'll also notice things like they might be showing signs of head pain. So like when you're stroking them on the head, they might be pushing the head up against your hand, and they might head shake, that kind of thing, a bit of squinting. But yeah, anything like that, pituitary tumour is most likely. I will say there are other brain tumours, but pituitary tumours are really common in female rats because they're associated with the hormones, or most of them are, I should say. There's a number of pituitary tumours that don't seem hormonally driven, but they are more common than we think. I read a study, and it was a particular strain of rats, but they reckoned it was around about 50 to 60% mark in the older bracket of does, I should say, age. Again, like mammary tumours, bucks can get them, but they're a lot less common because they don't have as many female hormones. But yes, so they're often driven by your kind of female sex hormones. So that means that spayed rats, much like Twizzle, who's come and visited me again, aren't you good? Well timed. Yeah, so spayed rats are less likely to get a pituitary tumour, so that's another reason to consider. But I will say, I think a lot of rats have a pituitary tumour without any major symptoms. We might think they're going a little bit senile in their old age before something completely unrelated takes them, or we have to put them to sleep for another reason, and never actually know, because a lot of them are microscopically tiny and probably have very little impact. It's only when the rat lives long enough that they kind of grow that size that you start noticing that there might be problems. But that is a bit of speculation. It's not something that you can easily check for on PM unless it's a large tumour, and even then you need to kind of know what you're looking for, because rat pituitaries are absolutely minute. So it's not something that I kind of have checked for regularly on PM unless I see, well, I don't need to if I see the symptoms, because it's pretty definitive at that point. So pituitary tumours, I should briefly mention treatment is usually steroids, and if they are hormonally driven, it can be worth trying something called caboglobin, which is also known as Galastop, which suppresses the kind of female hormones. That can also help slow the growth of mammary tumours. You can see they're both linked, a very similar hormone involved in driving them. So it can be worth trying, but I will say Galastop really is hard to disguise. They don't like the taste of it. It's very expensive and it doesn't always make a difference. So it can be worth trying if it's a slow growing one, but generally speaking, most pituitary tumours, when I know it's a pituitary tumour, I put them to sleep, unless they respond very quickly to steroids and the progression is very slow. If it's a fast onset one, it's not a good way for them to go. It's quite horrible. But watch the video for a bit more information on that. So I'd say that's the big three for female rats. We've got mammary tumours, pituitary tumours, and kind of womb issues, with PIO being the kind of most commonly heard of one. Though interestingly enough, I found bleeding that isn't PIO to be more common in our rats, but bear in mind we kind of try and select for rats that don't get very many mammary tumours, etc. So that's probably influenced our stats a little bit. Sorry, Buggy's climbing up somewhere she really shouldn't, and I'm hoping she doesn't fall. I think we're good. Yep, she's alive. It's one of those where I don't know if I had to run across the room or not, but she figured it out herself. Right, so those are the three. And we've talked a little bit about spaying, and spaying does help with two of those quite substantially, and one it completely eliminates. So you can see why spaying preventatively is something you might consider in female rats. But like I say, it's a big operation, and it's something that I would only consider electively or preventatively if you've got rats that are from a line where there's either really high incident of mammary tumour, really you don't trust the source, so like it's a pet shop, rescue, that kind of thing, and the rat's in really good shape, and you've got a very good vet who's used to doing spays, because it's not a straightforward operation unless you've done a lot of them, but it's a lot more invasive. You go into the kind of abdomen, anything in the abdomen carries a lot higher risk than just kind of taking a lump out, which is usually surface. Trying to think if there's anything else. I will say I do seem to notice more urinary tract infections in does. I'm not entirely sure why, but it's one you do want to keep an eye out for, and that would be you'd see potentially some blood in the urine, so it's kind of diffuse pinky coloured urine, or more commonly you see them walking a little bit stiffly, a bit uncomfortably, and you're not really sure what. Test the urine with the urine dipsticks, there is a video on that, and you pick up traces of blood in that, so they do seem to come up from time to time. I think other than that, those are probably the main things. Of course, when I go off this video, I'll think of at least 5 other things I should have mentioned. But I would say, as on the whole, with does, and it's the kind of major difference to owning bucks in terms of health, they cost more. So all 3 of those things that I mentioned with does, so mammary tumours, it would probably cost, at my vets it costs about 150, but let's say 100 to 300 pounds to have a mammary tumour removed. Spaying seems to cost anywhere from 80 to about 300 if you need to do that. Pituitary tumour, if you choose to treat it, steroids aren't that expensive, but a bottle of Galastop seems to be about 80-90 quid, and if you can get through that very rapidly. So these are all things that kind of cost. So it's something that is really worth bearing in mind if you want to keep does. They do cost more to keep than bucks, and there is no doubt on that. Bucks generally, if you look at their major health issues, they're things like hind leg degeneration. Does do get that, they just get it a lot later on, and it tends not to be as faffy. Wherever Snuff Kid is, she's starting with that at the moment. She's a bit over 2 now, but it's going very slowly and you can barely notice it. But you can't really treat HLD, it doesn't require a vet visit, it's just talking about management of it. Unless it's kind of like arthritic, then they might benefit from a bit of painkillers, but again, very low price. Kidney issues, you can go to the vets for that and get some medication. It's fairly straightforward stuff. You can also manage by a diet. It's kind of one of those, you may choose to or not choose to treat it. And both kind of, you can give good quality of life, just depends on how severe the issues are. And abscesses, generally most of them you deal at home, and the ones that you wouldn't deal with at home tend to be the ones that does are just as prone to, so like jaw abscesses and such. There's no higher incidence of that in bucks. Bucks tend to be more prone to kind of pituitary gland abscesses, which you deal with yourself most of the time, or kind of skin abscesses when they've had a bit of a scrap. So unless you really need to castrate a buck, which tends to be a behavioural thing, they don't tend to cost you nearly as much, unless you get one with chronic respiratory issues, but that's just as common in does as to bucks, so that's something to bear in mind. The other thing that's worth mentioning is does live on average a couple of months longer than bucks. It seems that their testosterone counts for quite a lot, really. They also seem to keep the fitness and their youth for longer, so they do kind of age slower than bucks. but it's kind of like one of those things. You just kind of adapt. If you're a book owner, your norm is a book lifespan. If you're a doe owner, your norm becomes a doe lifespan. It's just one of those. But I thought that kind of might be quite interesting. It's something that actually got me switching to books many years ago. I'd been through just too many lump removals, and it wasn't so much the cost, but it's the actual stress involved, and I think it's very easy to underestimate, like when you're having to take the rat to the vets again, and there's a lot of organisation around that, and then there's the stress of waiting to see whether they're going to come through the op okay, worrying about them and so on. It does become quite exhausting. I will say, now I've switched to breeder rats, so before that I had mostly rescues, and before that again pet shops, and they were incredibly prone to mammary tumours. They were around that 60% mark, if not higher than that if I'm honest, plus some of the food we fed back then was crap. I will say certain nuggets sold in the UK are, in my experience, lethal for encouraging the growth of mammary tumours. So you're talking about ones that have a high amount of kind of poultry protein in there. So the two brands that are kind of known for it around here are Pets at Home nuggets and Burgess nuggets. There is no scientific evidence to back this up, but I'm one of the people that experienced this, and we're talking about kind of ridiculous levels. The rats were sprouting 5-6 mammary tumours each, and it's not something that I'd ever seen at that quantities before. Every rat had a mammary tumour, unless she died of a pituitary tumour. I don't know if that was linked or not, but it's not something I will ever personally try again. But do be aware of that. Certain foods do increase the chances of mammary tumours. I think I probably mentioned this in the mammary tumour video too. I think that's probably it then. So quick recap. Does tend to live slightly longer, about 2 months longer than bucks. They tend to cost more in vet bills by quite a substantial amount. Mammary tumours are probably the most common issue that you're going to see in does, followed by pituitary tumours or some sort of uterine bleeding, often caused by pyo or polyps or things like that, which require a space. So those are the big three. Generally, they're kind of like, otherwise, they're pretty easy really. I would say in some respects, they seem to live healthier lives, unless they're popping up mammary tumours left, right and centre. Juby, you're going to be a healthy girl, aren't you? You're going to be my little healthy girl. But yes, so they do tend to kind of do very well. But yes, it's definitely worth being aware of what to look out for and how to act when you do find it. So I think that's probably it. I think I've witted long enough about kind of doe health issues. I will do a final one on this doe series, which will be on kind of dietary and kind of setup things. I'll probably end up mentioning the nugget thing again, knowing me. So hopefully that was useful for you. So over out from me and the rats.